So thank you very much for that talk. Certainly, a challenge of access, and you're highlighting that, and quite the journey to get a diagnosis. There are looks like a couple of audience questions, so I guess I'll just go from the top here. So the first one is asking about what symptoms should a patient concentrate on when communicating to their family physician.
Yeah, so I did the short piece for As a Day in Bahrain, and basically just outlined sort of how your physician approaches a diagnosis. I mean, as they're asking you questions, they're going down different diagnostic pathways. They're looking at what your symptoms is, the sort of the what, where, why, and when of what you're feeling. So it's really in terms of, sometimes I think when we have a CSF leak, and I see this often online, I see this when I've talked to different people, we start to attribute every little symptom we have must be the CSF leak, from rashes to a sore foot. So what I've suggested in that video is how you sort of collect your thoughts together, and you think about where your pain is, for 80% of the time. So kind of where it is the most commonly, what are the most common associated symptoms, how long it lasts, what's the shortest it lasts, what's the longest it lasts, kind of the way a physician thinks when they're trying to make a diagnosis. So just to help people out. So when they go, they've kind of have some of those thoughts prepared, because it's so overwhelming, because there are so many strange symptoms, from the blurriness of vision to pain in the face or teeth to certain numbness. So I think it's just organizing your thoughts before you go and thinking it out, and not being so overwhelmed by your own symptoms, so that you can have an approach when you speak to your primary care physician, or your neurologist for that matter.
Okay, great. Thank you for answering that. So the next one here is, would you recommend multiple visits to the emergency department to seek treatment if your GP does not believe you?
And that's a real hard one. So, I mean, even myself as a GP, the issue is you don't get much information back from an emergency department. So if you're going to the emergency department a lot for a complex care, then there's nobody coordinating your care. You're going to see a different person every time. So so that adds to the delay in diagnosis. Certainly you should go. If I know the time I went, I was in excruciating pain, so that's why I went. And there's times when you should go. But I think working with your GP, and I know, because then that's why I sort of tried to address this issue, that people feel sometimes that's a real roadblock. So I think sometimes having that honest conversation, bringing some information, and at the other end of that desk is a human being, and I think and I hope it's a good one that you've got, but and I think it's addressing that, that your frustration, and that, and educating them, and that's really hard, I know, and a lot of patients are afraid to slide an article across the desk, but your family doctor cannot know everything. They simply can't, and especially with the speed of the change in diagnosis and treatments for many conditions. So they're struggling to keep up many times. So I think bringing that information, and especially in acknowledging that it's an uncommon condition. And so I think working as best you can, and I think in knowing that every time you go to emerge and something different has come up, or you've had a different approach or a different symptom, that is, and I think many patients mistake, they think that somehow the family doctor finds out about that, but we really don't. And sometimes if you get an emerge sheet, something scribbled that we can't even read. So and to me, I often say to my patients, a diagnosis is often like a puzzle. So there's little pieces that we put together that we finally get a diagnosis. It's a rare condition that somebody comes in and right off the bat, especially if it's complex, that I'm going to diagnose it in 15 minutes. So it's often those pieces that we fit together that we make a diagnosis. So if your GP is missing, or your nurse practitioner, whoever your primary care provider is missing those little pieces, then they won't make that diagnosis, unfortunately.
No, thank you. And there's another one now here about whether or not you have any good suggestions regarding pain medications. The person that's asking the question seemed to be having significant levels of pain that interfere with, quality of life. So whether or not you have any advice on that regard.
I think that's so individual, and I stayed away from really giving you pain advice, because it's so different for everybody, and I'm not a pain specialist, and that wasn't sort of where I was going with the talk. And I would encourage you to speak to your neurologist, and there are various options, and I know sometimes people feel like they don't want to, like I know they don't want to get Botox because then they feel like if they get Botox, then someone's going to have decided that it's a migraine and they're not going to get, not going to be taken seriously, but it's a CSF leak. But I think in the meantime, sometimes in acknowledging that this is a journey, if Botox gives you relief from your pain till things are properly diagnosed, then I don't see that it's a huge issue, but I know I felt the same way. I didn't, I thought, well, then they're going to think it's migraine if it works. So I think, because the pain is so significant, and I think whatever modalities that your specialist, encourages you to try, I would try, but that's a very personal decision, right? And I know many people they feel they don't want to mask the pain or whatever else, but it's a cruel pain. So I would work with your specialist to address that issue. And certainly I'm very sorry to hear that you have significant pain, and I would reach out to your specialist and get that seen to.
Okay. Yeah, thank you for that. And it looks like there's just one more question. So geographically specific one, it looks like we have a member of the conference looking for any recommendations about specialists in Colombia and whether or not you knew anyone that could help on that front.
In British Columbia?
So it appears to be Colombia, the country, as far as I can tell from the way it's written here, not British Columbia.
And I'm sorry, I don't at all. I wish I did, but I don't have any information on anybody working in Colombia who might. You may find that on one of the inspire.com. You may find, because there's people from all over the world sort of on that site. You might be able to find some information there.
No, great. So certainly worth having a look at that. It looks like there aren't any other questions. So I think at this point, certainly thank you very much again for your talk and for taking the time to answer the questions. We will have the kind of panel discussion at the conclusion of the other talks this afternoon. So we will certainly hear more from you there.
Thank you.